going to be a very valuable informational webinar, and we hope and intend for you to leave with lots of great information related to staff recruitment and retention challenges in PHPCs. Joining us today for the webinar, we have some of our favorite staff members from health centers. We have Allan Cintron from Centro Community Health Center in Puerto Rico, Francis Afram-Gyening from Caroline's Community Health Center in Ohio, and Zara Marselian from Maestra Community Health Centers in San Diego. And they're going to share some of the challenges that they've encountered as it relates to staff recruitment and retention, and solutions that have worked for them that hopefully will also work for you. For those who do not know, we are the National Center for Health and Public Housing, and we are a project of North American Management, which is supported by a grant from the Health Resources and Service Administration, also known as HRSA. The information and context of this is solely ours and necessarily doesn't reflect the views of HRSA. Our mission here at the National Center for Health and Public Housing is to strengthen the capacity of federally funded public housing primary care health centers and other health center grantees by providing training and a range of technical assistance. Just to give you all a couple of background information as it relates to employee retention, specifically among PHPCs, public housing primary care, we have a couple of data with you. We conducted a needs assessment earlier this year, asking a variety of questions and a few about staff recruitment and retention. Fortunately, what we found out was that about 2/3 of our health centers have an employee retention rate of 81% or higher, which is good. It means they're able to retain their employees, both medical, support, admin, IT staff. However, we have about 1/3 who find it challenging and are only able to retain either between 61 and 80% or between 0 and 20%, which is low. This slide right here holds a lot of information, but the key thing to take away is that what has the lowest retention rate, which is less than 75%, are mental health providers. That's where a lot of PHPCs struggle, is retaining their mental health or behavioral health providers. Where they have a retention rate of 75% or more is among obstetrician gynecologists, and then also among nurse practitioners. The respondents to our survey, among respondents to our survey, 30% say they have a retention rate of 50% or less of medical professionals. So as stated earlier, and as you can see, this is definitely an issue for many of our PHPCs. They're having trouble maintaining medical staff. So what are the greatest challenges when it comes to staff recruitment, when it comes to recruiting and encouraging providers to come and work with the health center? It's number one, competition and salary. As many of you know, and it's no surprise to you, as a health center, you're competing against private practices, you're competing against hospitals, and so it's hard sometimes to entice people when it comes to the money and the benefits of working to health centers. Other challenges include limited resources, the location, the mobility, not being designated as a health service designation, and educational opportunities, and then some of the candidates are overqualified. When it comes to the challenges of retaining staff, so once you have a staff member, a medical professional, how do you keep them on board? The number one challenge, again, was compensation competition. So this goes back to the benefits and the salary is once they're on board, being able to compete with enticing offers from hospitals and private practices becomes a challenge. Other challenges that they face are unrealistic employee expectations, the huge workload, the lack of training, retention plans, how well they fit within the community and the population that they serve, their employee relationship, and then just and then there's several other retention challenges that they mentioned. We asked our PHPCs, for those that have been successful, such as our panelists that are on the webinar today, what are some strategies that they've found to be successful? What are some things that they've tried and are currently working for them? What they put, number one, not surprisingly, is competitive benefits. So finding creative ways, creative benefits to put into the compensation package, to put into the hiring package. Offering loan repayment, and this kind of ties back to being designated as a health provider service area or a national, or having that designation. Having a positive work environment, offering professional development opportunities, the resources and equipment available to the providers that serve, employee recognition. So being able to recognize those who are going above and beyond and recognize their hard work and commitment to their special populations, having the proper working conditions, opportunities to advance and have promotions, taking regular employee satisfaction surveys and finding different ways that they can encourage and promote a healthy work environment and have their employees stay. So now we will hand it over to Allan Cintron. Allan is the Executive Director for Centro, from a federally qualified health center in Puerto Rico. Centro manages 58,000 primary care patients a year and has over 300 employees serving at 8 different sites. Prior to joining Centro, Allan serves as the Executive Director of Ray of Light Public Housing Residence Economic and Human Development Project in Puerto Rico. Allan is very experienced in this area and has a wealth of information to share, and I hope that you are able to gain some information from him. Allan?
Good afternoon. Good to meet you all. Happy to be here. Hold on a minute. Happy to be here with all of you. Yes, Puerto Rico is, as you all may know, is really undergoing a major financial stress during these days. So what we will bring to you is Puerto Rico's economic impact over a healthcare center. So I'm going to go a little bit over some of our profile. We are a not-for-profit community-based healthcare service corporation, and we were founded in 1971 as Consejo de Salud de la Comunidad de la Playa de Ponce Incorporado, which is a very long name. So in 2009, we changed it to Consejo de Salud de Puerto Rico, Inc. Part of Puerto Rico as part of our scope of area. The service area population, we serve the population overall in the 4 cities we serve is 292,597 people. And the number of patients served is 40,337 out in all those areas. We also have the Ryan White program, which accounts for 254 patients. And we, along all 1,381 healthcare centers across the nation, we rank number 20. So it's a major organization of healthcare in the United States and, of course, in Puerto Rico. So if you can see in the graphic, that's where we rank according to HRSA Federal Grants Award. Now, our staffing mix comprises for 353 employees, out of which you can see 54 are today clinical providers. And we will concentrate our presentation on clinical providers, as that is the area of that has become very, very critical for us. As you can see, we currently have 54 clinical providers. However, we should have 57 clinical providers as of today. That has been a major problem, and although we do all sort of recruitment efforts, it's very slow. Now, why is that happening? Recruitment and retention areas, the external problem is that throughout years 2012 throughout 2015, Puerto Rico economic crisis has provoked in the island a massive immigration of physicians to the mainland states. This is expected to worsen throughout coming years. Thus, this has become an external threat to all healthcare center organizations in the island, including ourselves. The internal problem is that throughout 2012, 2013, and 2014, Centro lost physicians at an average rate of 12 per year. In 2015, physicians' turnover rate was reduced to 6 in this year, and within a shorter recruitment interval. So it's kind of, we kind of stopped that rate, and we have kind of overcome it. Not at the full compliance as we would like, but at a very reasonable pace. The problem contributors are salaries offered at states in mainland double those offered in Puerto Rico. So physicians are moving out of the island into other 48 states. A drug is produced by physicians who move to the states in mainland and call their colleagues in the island to follow their successful steps abroad. Also, the economic incentives offered by local HMOs promote physicians' movement into independent practices. However, and this is important to mention, it is our opinion that some of these incentives encourage practices that are highly questionable regarding quality of care and non-compliance with standards of care. Also, the cost of living has significantly increased in Puerto Rico, thus provoking more movement to the mainland states. The roots of economy: decreasing supply, increasing demand equals increasing cost. Thus, physicians' recruitment and retention is now more than ever before vulnerable to the offerings of local competitive marketplace. So there are few physicians available and more practices competing for those physicians. And also the economic restraints under which healthcare centers must operate reduces the ability to be competitive. However, there are opportunities out there, and we have used each and every one of these. First, physicians with social and other local attentions are really looking for financially stable organization where they can shelter, and we certainly are one of those in the island. Also, the wraparound payments to FQHCs provide institutional financial leverage as to be able to offer economically competitive compensation packages to physicians. And in 2011, we came to a settlement agreement with the state as to come to wraparound payments on a regular basis. Also, physicians' benefits for free medical malpractice immunity under Federal Tort Claims Act is a very attractive part of the compensation package for the physicians that work for MedCentro. So, and finally, this has been a very important one: National Health Service Corps loan repayment program for qualifying physicians who still owe education loans. And I have to mention that we have had near 15 of these physicians qualify for loan repayment programs. So I'm gonna go and explain a little bit more about the loan repayment program. Licensed healthcare providers may earn up to $50,000 towards student loans in exchange for a 2-year commitment with a National Health Service Corps approved site like MedCentro through the National Health Service Corps loan repayment program. Qualifying application must be for providers working at or have an accepted offer of employment at a National Health Service Corps approved service site. So you have to be an approved site before you can really apply for this loan repayment. The application period normally opens from February through August each year. Provided specialties cover family medicine, gynecologists, internal medicine, psychiatrists, psychologists, geriatrics, critical care nurses, dental primary care, pediatricians, and other provider specialties that qualify, but I just mentioned those that are important to MedCentro. The time and effort required is either part-time for 20 hours or full-time for 40 hours. The benefit incentive amount per practitioner is up to $25,000 per year, so that makes it $50,000 in 2 years toward loan repayment. There are no costs for the institution, and the duration may be for 2 years and normally renewable for an extension of 2 more years for a total of 4 years. We have also developed some very unique strategies from our institution. Merit-based incentive program, through which we commit and through which commitment and performance are financially acknowledged with awards up to $30,000 per year above the base salary during this very same year. And those are by numbers of fiscal year 2015. Also, a recruitment loan of $10,000, which is an upfront and above base salary for newly contracted providers. Retention bond of $5,000 upfront and above salary for providers' contract renewal. Also, we have made very important efforts to be highly committed with an enhanced work environments and social acknowledgement of Centro brand. So we're very highly acknowledging our community as a first-class healthcare center. Also, sustained reputation of financially stable organization and its commitment of high-quality care. About the merit-based incentive program. Merit-based incentive program is a financial award that is available only for clinical faculty providers who are employees of Centro, and it uses a metric-based methodology on qualifying indicators and merit indicators, where providers who qualify for incentives are acknowledged for their commitment and performance. This program was created by Centro in 2013 as a strategy to improve recruitment and retention of clinical providers, because we were already foreseeing that recruitment and retention of providers was becoming a more and more aggressive program. So how this works? As I mentioned before, there were qualifying indicators and merit indicators. Qualifying indicators are those which the provider must completely meet before being considered for an incentive. Not meeting all of these, and I say all because they have to, when favoring one of them, disqualifies them, completely disqualifies the provider from receiving an incentive. There are 6 qualifying indicators. And once you pass that, then the merit indicators provide the metrics to determine the provider's amount of share of the total amount allocated by the board of directors in the institutional budget for the financial incentives in a year. There are 12 merit indicators. And the reason why this works like this is because this cannot be confused with a profit share. It is not a profit share because we are a non-profit organization. So what happens is that at the beginning of the year, it is budgeted. So there are no conflicts with or confusions with a profit share. In year 2015, the board of directors approved a budget allocation for the merit-based incentive in the amount of $1 million plus mandatory taxes. These are the qualifying indicators. First, qualifying providers that have no severe disciplinary actions filed during that year that is being considered for the incentive. Second, there are no affirmative complaints under investigation. You might not have a disciplinary action, but there might be an investigation on misconduct. So if you are, unfortunately, if you are under an investigation, you will not be able to get the incentive that year. Third, they are in compliance with the patient quota. All providers have a quota they have to meet each year in of the number of encounters they realize each year. If they go under that quota that is given to each one, you know, they're just disqualified. The employee has to be an active employee during that full fiscal year, and that certainly goes to the retention goal. You must have an evaluation score above 70. We consider anything under 70 underperforming. So you must have the 70% score in your yearly evaluation. And lastly, there are some providers that we negotiate certain special contracts, and because of the high level of payment or whatsoever, they're excluded from participating in this incentive program. And we have like 2 of those. Then once you pass those 6 qualifying indicators, then you fall into the merit indicators, which will rank you in the amount of the incentive you will be receiving. First, the professional rank, and according if you're a general medicine, specialized medicine, subspecialized medicine, a dentist, psychologist, you fall into different categories. And then you receive certain points of awards because of the category in which you are in. Then the annual evaluation, anything about 70 will be considered for merit value points. Attendance commitment is very important. That goes to attack the absenteeism or lateness to the job. So that is measured, and you receive award points for compliance with your attendance. Credentialing compliance has or was a huge problem, and it's kind of completely corrected. So if you keep your credentialing up to date, you receive merit points toward the compliance award. If you preside an institutional committee or you are a department director, you also receive merit points because that's supposed that you have some extra workload and you are acknowledged for that. If you perform an extraordinary achievement, that's something extraordinary you did during the year, you will also receive merit points for that. Quality compliance. Quality stands at the top of all priorities in the organization. Merit value points are awarded according to a scale to those practitioners that demonstrate to be immeasurable high compliance with the expectations of the clinical indicators according to the reports of the Department of Continuous Quality Improvement and Quality Assurance. And this is an area that this year will gain additional points and it will become of a higher importance for the final evaluation and the incentives that will be awarded. Administrative compliance is expected from all providers. So like things like coding, patient checkout, closing, billable encounters, all that is measured as well, and you receive points for that. Sick leave allowance. If you were not sick throughout the year, you will receive extra points. You have an allowance. In Puerto Rico, the law allows 15 days of sick leave. That is the law. So if you don't use your sick leave, you will receive extra points. Some of our providers attested in favor of our healthcare center, and the center did receive the designation of the Medicare, Medicaid Electronic Health Record Incentive Program, and they are awarded points for doing that in favor of our healthcare center. Productivity is measured by accounting the number of face-to-face encounters the provided program in a given year, while productivity quota is the qualifying criteria for receiving any retention merit financial incentives. Some providers are able to exceed their quota, thus denoting extra effort, so they are acknowledged for that with extra points. Finally, pledge for forthcoming years. Those who sign a pledge for forthcoming years to be contracted to continue working with MedCentro do receive extra points. How is all that produced? I'm going to use the 2014 scorecard to illustrate that. The highest award last year was capped to $20,000, and The lowest paid last year was 4,430. So what happened is that 26 out of 49 last year, 26 qualified to receive incentives. Remember that some might not have worked for the whole year, so you need to be a full year. One had a disciplinary action, so couldn't receive incentive at all. So 26 received, and the mean was $17,791. So in total, $462,574 were awarded that year, and we never reached the total amount approved by the board, which was $505,000. So there was a carryover of $42,426. This year, the board has approved $1 million plus mandatory taxes to be used for the incentive program, and the capping was increased from $20,000 to $30,000. As you see, as we're entering into a more critical years, we will be increasing our incentive program. So instead of just adding to the base salary, we're really doing, improving the payment while retaining the providers, while also committing our providers with the quality of their services. So, despite all that, Centro is also a fun place to work, and I know Jose will acknowledge this. We also do every year, cycling is our flagship to our community. And also a chance to meet great people like Jose and Karen. So it's been our pleasure. I hope the information shared could be of help to you.
Thank you so much, Allan, for that great presentation. Thank you. That was some really good information and strategies and tools. We're now going to have... Okay. Well, I do that. Zara Marselian is CEO and co-founder of Maestra Community Health Center and the Maestra Foundation. She founded Maestra to provide health care and social services to help the underserved immigrant and refugee residents in the inner city San Diego community of City Heights to become healthy and self-sufficient. Since 1990, Maestra has grown into a nationally recognized organization with 400 staff serving over 45,000 patients annually, with locations in City Heights, El Cajon, National City, and Lemon Grove, and other areas across San Diego County. Please welcome Ms. Zara Marselian.
Hi, this is Zara. Thank you so much for inviting me to present today. I just wanted to give you a brief overview about La Maestra. It's a very grassroots community health center, and we provide medical services and many other social services that we'll talk about in a minute. And so you can see how staff recruitment and retention is, really a huge focus for us to make sure that we do find people that match and fit in with our mission and can help us grow and expand and do a better job for the community. And then we in turn promote a lot of educational opportunities and subsidize our employees if they wish to continue their education and certification. So we do invest in them. Our staff are from the diverse communities we serve. But here, to go back here, the first screen can show you on the left side, there's a picture where we originally started, was in actually in the living room, because at that time we had a nonprofit school that was called La Maestra Amnesty Center since 1986, and we provided amnesty services, the applications for phase 1, phase 2 residency to 12,000 students And those 12,000 students, 9,000 actually went through the amnesty program, through the different categories that they were able to, qualify for eligibility. And then they themselves said, what we really need is we need health care in our community provided by, workers and staff that care about us, are from our own cultures, so they understand us and just help us get through all these challenges and barriers that we see. So 20 years later, we were able to open the building, construct the building on the right, which is a first Gold LEED certified health center. Fantastic. We do have the different locations that Joy mentioned throughout San Diego County, different parts of the county, as well as 4 schools. We have a mobile medical and dental clinic, and recently we just rolled out a mobile imaging for mammography coach. It's fantastic. So now we'll be able to go into more of the rural areas, I should give you a little bit of background on San Diego. San Diego County does not have its own hospital. So people either go to the emergency room or they look for safety net providers like clinics. So here we're on the next slide. This is, we're a very culturally diverse community. We are in a resettlement zone here, which means that since before 1975, the voluntary organizations that contract with the State Department bring over and settle refugees arriving from different camps abroad and so forth. And then we have others, actually more, that are originally settled in other states like Minnesota and, Michigan, and then they make their way down to, out to San Diego because there are, family members or similar cultures or the same culture communities out here, ethnic-based organizations. So we do have quite a few refugees from many different countries, and they, they're fantastic. They bring a lot of resources to the services that we offer, the outreach, the health education, the referrals, the case management, everything. They're very much involved, and they train us on their traditions and cultures and so forth. And then, obviously they are a liaison for our health providers to impart the information that their community needs about, let's say, breast cancer and why you need to come in for a mammogram, or the importance of seeking prenatal care early on when maybe in their culture or their country they just didn't have access to preventative care. So, the list just goes on. So it's a fantastic model that we started with early on because we are grassroots. Our board is from the communities that we serve. Our staff are from the communities that we serve. So it was kind of all inherent there in terms of this wonderful liaison program. Slowly but surely, we added on many different, very comprehensive services from the medical clinic itself, caring also for the other areas of service that we know our populations and that they need to access for them to achieve wellness. And so we kept on with our job training programs, economic development programs that we had opened under the Amnesty Center back in 1986, kept growing those collaborations with other partners and agencies in San Diego and nationwide. And we went into, housing for people in recovery, and again, providing them reentry mainstream into society by doing job training, getting something on the resume, getting them out there, and then also starting up businesses that we could, put people to work right away that maybe didn't have the skill set to be able to go out and compete for jobs that are pretty scarce here in San Diego anyway. So we opened a flower shop. We opened a green janitorial cleaning service. We opened up a print shop, And we also have a laundry, linen, laundry, and then we also have done security. So we're always looking for different micro enterprises like that we can, that are sustainable and provide that entry level for people that are needing to, gain job skills and so forth since 1986. So it's almost, 30 years. And all of these spokes are extremely necessary to what we've found our populations need to achieve wellness and legal advocacy, social services. You can see at the bottom, this is, just incredibly necessary, especially with our victims of violent crime, domestic violence, human traffic victims. We have a contract with different law enforcement agencies to participate and go on sting operations, and then because then we get the victim and we're able to help this person or the family access the services that they need, go through the legal process, help them navigate it, and pretty soon they're sustainable and they have they're on their way to healing, and then they can navigate very well themselves. So we know that health is not just a trip to the doctor. It involves these other services. And to be able to effectively offer these services, as I said before, is, even if we just focus on the medical side, we try to find physicians that were physicians in their own country, and perhaps for whatever reason they didn't want to take the boards here, they couldn't qualify, their English was not the proficiency level required to be able to pass the exams. We definitely employ them in our health education, helping with case management, and they'll help with interpreting, translating, and so forth, because it's not just translating the language, it's basically interpreting people's beliefs and cultures and trying to include that awareness in the delivery of health education. So for example, we're not going to go into each different ethnic community the same way with the same message, because it's not going to work. And that requires us to have and recruit people from those different populations. So it's not just ethnic populations, it's people that, for example, are from I now say culture. It's not necessarily just ethnic background. Culture could be maybe they, they're a veteran. Well, we have people here on staff that are veterans that then are able, very effective, to reach out and to help fellow veterans navigate our system, not just our system, but beyond primary health care, beyond the specialty, and so forth. So the same thing applies with our population that are, with addictions and in recovery. Who do we have working with them? People that are in the recovery community that have now gone through, many of them sponsored by us, to go and get their addiction, drug and alcohol certification, counseling certificate. So those, some of the tips, I've been often asked at different conferences that I present nationwide, well, gee, how do you find these, culturally competent people? Well, one thing is to definitely know, the populations that are out there that you're serving or that are in your catchment areas. Several times I've gone and done some, mentoring with, sister FQHCs and so forth, and only to find that they really aren't aware of the populations that they could be serving, and that are living in their area, but they don't know how to, include them, or perhaps they don't even know how many, what are the numbers like, what are the needs there. So, another good strategy is to look for the ethnic-based organizations once you find that there's different populations in your community. Seniors, are there any, groups that specifically cater to seniors, whether it's faith-based, whether it's, the Meals on Wheels in the area, whether it's the caregiver support programs for dementia and so forth. There's a number of ways to go about this. Veterans Council is another. So it's kind of like casting the net out there and saying, okay, what other organizations are in our catchment area, and how can we best collaborate with them, increasing access to care for their clients, their customers, that could become our patients. And then how can we do a great job with those, with those services for these specific populations. So some of the challenges that we've faced with recruitment and retention of staff, we have a lot, most of our work is here in the urban setting. I guess the large hospital systems are the biggest competitor. Oftentimes they will offer our doctors, not just us, others as well, they'll offer them a much, what seems to be an incredible, pay raise, even though we constantly look at what the competition is paying, what is the market allowing in terms of all of the jobs we have. We have like almost 500 employees now. It's all the way that the package is constructed. So like, for example, the hospitals will say, we'll pay you $6 more an hour, but they don't tell the providers that they're going to be on call 24/7, that they're going to, have, 12-hour days, that they're going to, not have, let's say, the match of the 401k retirement that we have. So it all sounds real good until they actually get in this situation. And we have many providers that will call us within the year and say, you know what, I know, I signed on for this year over here at this hospital, and, I'm getting burned out, and I really want to come back and work with the community, with people that I really feel like what I'm doing there every day is making a difference in their life. And so those are the kinds of individuals that we definitely try to recruit, not just, people that need a job and need their pay and offer good benefits, of course, but finding through the interview process and the vetting process and, multiple interviews. And then, of course, we have the employee orientation, that it gives us an opportunity to really see for us and for that potential employee, is this really a match here for you? Do you really like this kind of environment? Do you like working with people? If not, you certainly shouldn't be at the front desk. That's just an example. And so we try to really go through that job description with them and let them see what it's like. We want to invest on the front end of that whole engagement process, because if we wait, then and we don't put that preventative kind of work up front with our employees as we are hiring, before we hire them and during their orientation process and their probation period, it ends up just costing way too much. So, obviously there's times that you cannot deselect people because you don't know, or they haven't exhibited certain behaviors, that they're not a match, or they weren't really upfront about things. So we just have to carefully be doing mentoring and coaching with our staff. We have a great management team, directors, in each one of our components, service areas of our clinic, that are participating on this management team. And we've launched a evaluation process that's really, a mentoring, where we don't wait until the end of the year to evaluate somebody, because by the end of the year, it's like too late now. And you really don't have a lot of opportunity to do training, mentoring, coaching, when some employee has already, committed or gone through, way too many issues, problems. Perhaps they haven't, been performing as they were trained to, or they have behavioral issues. So that's going to help us a lot, I think, do more prevention and coaching along the way, as well as this other system, the software that we piloted out, and it's called Patient Angle. And if any of you are interested, let me know. It's fantastic. We first implemented it, very inexpensive little tablet, that we kind of, bolt to the countertops there at any checkout point or any service, reception area. And we ask the patient to look on the screen and pick the picture of the staff that they dealt with in that unit today, for example. And they just have to touch the screen, and it's all facial recognition. And then there's smiley faces. And there's an area there for people that want to comment. Well, what this does from a quality perspective, customer service perspective, you can imagine. But what it does, we didn't realize this at the beginning, but we, really quickly did after that, was that it's such a great feedback immediately on those employees that are having issues. So we don't have to wait, for months later to find out that, gee, this person was exhibiting this kind of behavior before, nobody caught it, nobody documented it, wasn't proved, and so forth. Well, right there, when that patient enters that information, that feedback goes directly to the employee, the supervisor, and HR if it falls below a certain level. So we can then look very quickly at trends by employee in that department or by the whole department. So that's kind of been a great incentive for our employees to want to do well. They like to be recognized for their performance and the way that they care for our patients. And when that's then validated by these systems, it really is very meaningful. And then, of course, we have, our Caught You Caring program and awards and so forth, and bonuses as well. All of that seems to help, especially, with the whole issue of other organizations trying to compete for our providers, our nurses, especially after we train them for how many years, and they're great with our populations, and then they walk off because some hospital's paying them $5 more. So I think that I think our employees are our largest assets that we have, in terms of the organization. So I think that we do need to really look at what programs are in place and how can we enhance our employees feeling value from their experience here, not just consider it as a job, but as something that makes them feel better and about themselves, and gives them that satisfaction that they spend how many hours every day somewhere. They should feel that value, and to know how that quantifies in terms of quality of care and patient experience. So those are the points that I had here today for you. Thank you for letting me share this with you.
Well, might even advance more beyond the $12 million budget that we currently have. So there has been a lot of growth for the organization, but it's such an exciting gem in the community. So what's our